Ow!
Where?
Where, just below your hand.
Where I'm pressing? Okay.
Just below it.
Okay, it's okay. It needs to unlock.
I feel like I gotta hold on.
Yeah. You got a lot of power, but with power comes stiffness. With great power comes great responsibility. Thank you, Uncle Ben.
Yeah.
Leg pain and rib pain from basketball?
Yeah, so I was playing basketball, street ball, and after I played, I had swelling behind actually both of my knees, but my right knee was the worst.
Okay.
And both of my knees, just the whole knee swole, like all the way down to my ankle, like it was one shape.
Okay.
And that went on for probably like a couple of weeks. And
Was there any discoloration? Did you see any bruising? Nothing?
swelling,
Just
and I
okay.
could not bend them or really walk. So I did a lot of ice, and then I did like ice heat baths, and I did Epsom salt baths, Dead Sea salt baths. I did massage. I've done chiropractic. I've done dry needling.
It was both knees?
Yeah.
And did you feel anything during basketball? Did you didn't feel any tweaks or anything?
No.
Okay.
I haven't had like X-rays or MRI or anything like that, but it seems to be just musculoskeletal. It seems like they're knots. There are like physical knots in my calves and my feet, and then my shins. If I start, like now I can run. This was 3 years ago, so now I can run, but I get like drop foot. Like I can't pick my toes up anymore.
Okay.
And it's fatigue that I can't explain.
Okay. I want you to stand on one. I'm going to do a little test here. I want you to try to maybe use this table to help you balance a little bit. Table up. I want you to try to kind of copy what I do. If you need help balancing, just put your hand on the table. But what you'll do is you'll just stand on one foot. We hold the table for balance, and I want you to try to come up onto your toes. Is there difficulty?
Like repeatedly.
Good. Just switch the other foot. Try to come up on your toes.
I mean, what might be a little balance?
Okay. Now let's try the same thing. I want you to try to bring your heel on one foot. So stand on one foot. Stand on one foot, and then try to bring your heel, try to bring your toes off the ground. Not too easy.
No.
Try the other foot. Can't do it.
No.
All right. So we have a weakness of the dorsiflexor, right? So that's L5, L4, nerves in your lower back. Now, if you have both feet on the ground, you probably can do it, right? You can get your toes off the ground.
Rock.
Right, but it's hard. But if you do one foot, my father has a paralyzation of one of his nerves, and he can't. If he's on one foot, my dad cannot come up onto his toes. There's not enough nerve signal to the calf for my father to be able to plantar flex. But in your case, the dorsiflexion is tibialis anterior. So we have a paralyzation of the muscles. Essentially, they're getting some signal. There's overlap. So L4 provides some, L5 provides some. So you have enough to be able to walk, but you're noticing, hey, I can't lift my toes up when I'm walking. This is where a lumbar MRI would be indicated. And is anybody? That would be what we would use.
I had a lot of numbness and tingling in my mid back.
Okay.
My leg goes down to my arms, and my hands fall asleep.
How long? That's been going on the same amount of time?
That just started in the last year, about a year ago, actually.
And where exactly do you feel that right now? Or do you feel it now?
I don't have it right now, but the other day it was like a thumb and a finger. And it'll be random fingers, never the same.
The health of your knee and the health of your leg is all supplied by that nerve. So when the nerve is upset, you're going to have inflammation, swelling. Any area that those nerves go to, they call it reflexive sympathetic dystrophy, is one of the symptoms and diagnoses that can happen when a nerve is upset. So any area that nerve goes to can be unhealthy or inflamed.
I did something to my back when I was playing basketball that day.
Something happened where most likely you already had a disc injury, but under stress, the nerve started to get pressured, and then that nerve signal. So do you think when did the drop foot, when did you start noticing that?
I mean, I've only been able to run as of recently. So in the last 6 months, so I wouldn't have known before that.
Okay.
I don't even want to call it drop foot, but I don't have another term for it.
Well,
it's like shin fatigue.
That's nerve pressure. That's what I'm trying to tell you. It's your ability to dorsiflex is limited,
yeah.
Which is because there's nerve pressure on the nerve in your lower back.
Okay.
These disc injuries are progressive. They're like cavities in our teeth. they don't really unwind if they're not cared for. We can divert stress away from them and they'll calm down, but they're not something that will just resolve on their own. They usually progress to a greater level, and we need to get ice on your lower back, no heat on your lower back. You're young enough that these discs are made of water and they'll bulge out more. Again, until we get an MRI, that would be the way to validate what I'm telling you. A lumbar MRI, they're about $300, preferably seated, and then you'd see these discs and their interaction. You would see it interacting with L4 and L5. These last two branches down here are getting pressure on them. Now, if that MRI comes back clean, then we start zooming in on the leg, and maybe, but usually if you had a leg injury, you would notice it. You would know it, like when you were playing, like I went to make a move and I felt my knee give out, and then all of a sudden I fell to the ground, and or some sort of trauma to your leg, which would then indicate, okay, maybe you tore an MCL or a PCL or an ACL or something like that, right? But without any specific trauma, and then you would have some sort of bleeding, usually bruising. You would be bruising inside. Yeah, this sounds like the lower back got upset. Again, it's quite common. Our world gives us no guidance on prevention on these problems.
And you said you've been worked on up north, but no one's...
I've been worked on nationwide.
And no one's gotten an MRI
No.
of you? Is there any, do they ever talk about it, or?
The only thing anybody ever wanted was an MRI of my knee.
Oh, and chiropractors, physical therapists, all of them?
No one's ever recommended a MRI of my spine.
Yeah, the fact that you get, the only thing that's causing like tingling in your hands, the only thing that really causes that is pinched nerves in your neck. There's really not, I mean, people try to bring up carpal tunnel, for instance. Carpal tunnel is a very specific diagnosis. So the median nerve goes to your thumb, index, and middle finger. So if this area was the only area that was going tingly, and numbness in this area would only be exacerbated by bending the wrist, so pressing your back of your hands together or pressing your palms together. If that made your fingers go numb or tingly, that could be carpal tunnel. But just symptoms in this area is not carpal tunnel. And the fact that you're telling me, Ed, it's kind of all that.
Any of them.
It's any of them. That's because it's the branches of nerves that leave your lower neck called the brachial plexus. The nerves that leave your lower neck go to your whole hand. So it's pressure on the bundles of nerves in your neck. The only other bottleneck site, again, is the carpal tunnel, which would be just these three fingers, and only if you were doing handstands or something where, and I do a handstand and my hands go numb while I'm in a handstand. That would maybe something wrong with your wrist. But again, imaging is used to verify what I already know to be true, right? So physical exam and history indicate to me we got nerve pressure in your lower neck, nerve pressure in your lower back. We can get a picture and I can show you, but that would be, I'm 99% confident that's what we're dealing with. And we live in a symptom world, so the fact that most doctors are looking at your knee or looking at your hands perhaps, doesn't surprise me. Most doctors are all focused on the symptom, where the problem is. But again, the leg is a slave to your lower back. The health of your lower back and the health of your leg are tied together. So let's try to get some stress off your lower back, and we'll compare that at the end, see if we get any better. But those are usually, it takes time for those nerves to get pressured in the same way it takes time to unpressure those nerves. There's nothing permanently numb in your hands or feet. It just comes on and off. That's a great sign. That's a great sign that we can get you, to a place where it very rarely, or if ever, comes, that symptom happens. My dad's case, my dad's leg has been numb. A part of his dermatome, like for instance, my dad's side of his leg and his pinky toe have been numb for 30 years. Right, he's damaged the nerve in his lower back, and it never came back. So it went numb, and it stayed numb, and then he started having, if you look at my dad's calves, one of his calves about half the size of his other calf.
I did have numbness in my foot the other day, but I didn't. It was once.
It's okay. You have like a flickering light. You don't have an off light, right? So we're in a preventative place, in a great position to care for you and be able to try to teach you things to help prevent this from happening, or happening ever again, or maybe very infrequently. But
yeah, I don't know how I got like this. I don't know what.
Very common. It's okay. It happens from a young age where our alignment and our mobility is not checked. So when I care for you in a second, there has to be an area that's not working to allow your lower back to overstress. The discs have no feeling. So we can't feel a disc injury like a cavity in a tooth. The cavity grows without our awareness until it finally hits the nerve, and then when it becomes like, wow, how did this cavity happen? I didn't do anything. Well, it takes time, and our world, we pretty much live in a world right now in America where we react to problems. There isn't a healthcare program set up for when we're young, teaching people about posture and mobility, teaching people about alignment and curves in their spine. Bend both the knees for me. Let's get you some care here. Deep breath in, a little sit up. Head back for me. There you go. I got you. Deep breath. I got you. Exhale. All right, whatever. I know, I got you. Exhale. All right. There should be no apprehension in there. As much as Ed, just squeeze me hard. There should be nothing. I shouldn't be able to create any apprehension in that middle back.
I've been getting pain like that when I've gotten adjusted for the last couple of years, and it's not getting better.
Fix it. That's my job, is to help show you how we get to a place where your middle back movement, there's supposed to be a flexibility and a suppleness in there. If this is supple, then it's very unlikely that your lower back is going to be in distress. If this is rigid, it's very likely your lower back is doing too much work. All right, I got you really easy here. There we go. All right, okay. You okay?
Yeah.
All right, breathe real gentle. All right, good. The goal of that adjustment is to loosen your SI joint. We're not trying to, notice my hand was up here, right? I pushed up here and I pushed in your glute. Hopefully when you're back home, if somebody puts their hand in your lower back, you need to get out of the office, okay? My suspicions will be validated with an MRI, but if we see L5 and L4 disc injuries, nobody should be touching them. It isn't gonna help a cut on your skin to be jabbing your finger in the cut. You have wounds in your lower back. How can we help the wounds? Well, we're gonna loosen up the joints below and above to divert stress off them, and you will get better. And I will show you how to stretch so that mobility is maintained. I got you. So now I'm gonna show you. My hands up here in your middle back. Get the idea? You okay?
Those ribs don't move good.
Right. We gotta get this loosened up here, and then we're going below. I got you. It's okay. Exhale. All right. Okay. Face up. Face up. Okay. I want to be careful with that adjustment.
Yeah, those ribs have been hurting me for a while now, and I just don't know if it's all related.
Yes, sir.
Okay.
100%.
Right.
You have injuries up here, old injuries, that I'm going to go into and unlock. Massive left atlas here. Gee whiz. Feel that bone sticking out here?
I do.
Yeah, very. That's why you're going to be pinching the right side. So is it more the right hand or both hands?
It's more the right.
More the right, yeah. Yeah, because what happens is you're essentially in right tilt all the time. Because actually you're like my dad's neck. 15% of my patients are left atlases. Most of my patients are right atlases. You're actually a lefty. Real gentle. I got you. There you go. Notice my hand was right here at the top, right? I left your lower neck alone. The lower neck and your hand are the same thing. So there's no benefit if anybody puts their hand down here and wants to push, or anybody wants to yank real hard on you, I would run out the door. If I yank on your neck with a strap real hard, the lower neck is going to move the most because it's the loosest part of your spine. The upper neck is tight. So you're going to take whatever's loose and move it too much.
Yeah, I don't go to anybody who uses a Y strap.
I don't want you, until we get an MRI, and now if there's no disc injuries, then I'll be quiet, right? But until we know for certain that there isn't a disc injury, I'm going to assume that there is.
All this started about in the last 4 years. But prior to that, I didn't have any issues.
All right, yeah, nerves are like light switches. Until they finally reach a certain level to finally turn the light on, we're unaware. And that's when you reach the threshold, when you reach the cliff edge, was 4 years ago. But you lived 5 miles from the cliff edge, and then over a period from 20 to 35, you started walking closer. And then you finally dropped off, and that's confusing. Let's try to loosen this top guy a little bit. There you go.
Felt that all the way down to my pinky.
On the right hand?
Yeah.
Just the lower neck is so loose. The lower neck is so loose that even when I adjusted your upper neck, the lower neck moved too much. And the goal with your care would be we get to a place where that doesn't happen, that we don't move the lower neck. That further validates my problem. You're saying,
Okay.
this is so pissed off that I moved this bone and he moved,
Okay.
right? And it moved so much that you felt it in your hand.
Yeah.
Which again, further validates that you have a disc injury
Okay.
in your lower neck. I touch here and you get hand symptoms.
Okay.
Means that there's an injury in your lower neck. I'm sorry that you haven't had any diagnosticians properly label this for you. You do not have a hand, you will have hand problems. See, the nerve controls the health of your hand, so.
Yeah. Like I need my wrists adjusted
Correct.
periodically, and it feels like I'm being stabbed
Yes.
with a sharp object.
Correct.
And
You will have wrist and hand problems,
I
but
do,
it's
yeah.
it's still your neck that has to be addressed completely to alleviate the problem. Working on the hand, as much as it might feel good temporarily,
it's temporary.
correct. It has no long-term benefit. We have to alleviate stress.
Yeah. That feels like a bone.
Yes, sir. Yeah.
Is it?
Yes, the joint here is stiff.
Yeah.
The muscles are all spasmed and tight up here. We need to unlock the upper cervical, the atlas axis up here. Divert stress off the lower neck. This is supposed to be your main engine.
Just that is making my thumb numb.
You feel it in the fingers, yeah. Yeah, we got work to do, bud. It's just maybe somewhere else. It's the looking down. If you want to, it's not the
Yeah, I think it's the looking down.
correct. Yeah, it's not the use of his hands that's the problem. It's-
I notice it more when I'm looking down.
You got it.
When I'm reading.
Yep.
I have to read a lot.
Yeah, that compresses the discs.
I've had to start bringing stuff up to me.
Yep. Yep. Yep.
I've heard a lot of different things, but from different practitioners I've been to, and I just felt like I had to throw it all out. Does my jaw clenching have anything to do with this cervical?
Yes, sir. Yeah. So the more forward your head goes, the more you look down, like you're saying at work, the loss of cervical curve, forward head posture cause stress on your TMJ. Right? And so then when your TMJ is inflamed, it's going to get tight, it's going to get sore, it's going to get tight, you're going to clench more. So I would want to, first get your neck healthy, and then there are things we can, there you go, yeah,
I
that's,
crunch a lot.
yeah. Your neck belongs back here. There you go. So they make an orthotic called a Denerol that emulates my thumb, and it holds your neck in the lordotic cervical curve position. The goal of the chiropractic care is to make the spine limber and supple so that we can stretch the curve back to your spine. I can't put a person that isn't adjusted on it because they're mainly going to move in their lower neck where they're already moving, and so therefore most people get on a neck Denerol if they're not adjusted, and they end up getting hurt because they just bend where they're loose and they don't bend where they're stiff. The goal of the chiropractic care is to unlock the parts of the spine that are frozen so that when you're stretching, your whole spine works as a team and your spine bends where it needs to bend, not just further bending where you've been bending.
I also bought Normatec pants and sleeves because of the swelling, and that helps.
I understand. One of the quickest ways we can kind of validate with what I'm saying is you lay on your side, you take an ice cube, you hold it with a paper towel, and you ice your lower back.
I would have not iced my back. I didn't have any pain.
I understand, yeah.
I just
It's
wouldn't have
confusing.
thought of that.
All back pain is generally facet pain. So what you're indicating is you have no joint pain, but the discs are injured. Okay?
Mhm.
When somebody has back pain, they really mean facet pain. The knuckles and the spine are injured. You can have sciatica with no back pain.
Mm.
They're not.
Sure.
They sometimes happen together, and most of the time they probably happen together. Person has facet pain and they have sciatica, but that doesn't have to happen. You don't have to have both. All that means is you have nerve pressure, disc injury, but the joints in your lower back are not super mad. So it's hard. People don't connect the dots that there's still a back problem even though there's no facet pain.
Yeah, I would have said all this is musculoskeletal.
I understand.
Yeah.
The nerve controls, nerves are MRS, right? Motor, reflex, sensory, right? I'm sure if I checked your patellar reflexes, they're probably diminished. You understand?
Yeah.
Which we can check in a minute if you like, but I expect the patellar reflex to be lessened.
Because of the compression.
You're gonna get, right, you're gonna have diminished reflexes. but your dorsiflexion was all I needed to see. It's going to be mild because you still can dorsiflex. It's just weakened dorsiflexion.
It's actually something I've been working on because I know how weak it is.
Right.
It's a huge knot.
Yeah. How's that? You okay?
It feels I feel relief,
Yeah.
but I can't handle it long.
All right. Well, we have to get the back off it. You understand? You don't go so deep.
Yeah.
I'm just checking to see how deep you can go. And
I'm probably done right now.
all right.
Then it starts to hurt.
All right. Let me have you sit up for me. Shirt off for me. All right. Right there. Yeah.
Yeah. That's a problem. I feel like I gotta hold on.
Yeah.
Need handles.
Right there.
I feel bad you're not here for a day or two to get an MRI or something because it
Ah,
has that
I
good
can-
MRI place here.
Oh, I can get one.
Okay.
I have like a online imaging
Okay.
ordering system that I
Yeah.
have
Okay.
access to,
Good.
and I can order on my own.
Oh, that's
Sure.
good. That's good.
I actually did get an X-ray of my foot. Now that I think about it, and nothing was wrong with
I
it.
understand.
Shocking. It hurt so bad. I thought for
I
sure
know.
something was broken. You
I
know.
know.
That was a couple years ago.
So I can pay the big bucks.
Yeah. Yeah.
It's your spine. Extremely common. Again, I treat my patients from what is the most common explanation. 99% of the time, it's a disc injury.
Mm.
Also, the stronger your chest gets, bench pressing, most of the gym activities, you're better a gym worker outer, you're a better deadlifter, you're a better squatter with a rigid chest, right? And so if the chest gets tight, this area is going to be overstressed. There's no ribs in the lumbar like there's ribs in our chest to protect this area. The lumbar doesn't have the same level of protection. And it's always right adjacent to a stiff area. So the sacrum's fused, obviously, right? So we overbend, not the sacrum, right? It's all fused. We overbend right above it. We don't overbend in our T1, T2, you overbend right above it. It's always the areas right adjacent to the stiff areas that are the most likely to be the whipping boys.
Yeah.
To be,
I spend a lot of time on flexibility and mobility, and more so as I've gotten older.
I understand. You're flexible a
That-
lot in certain areas, but you're less flexible
Where I need to be.
where you need to be.
Right.
Correct. Yeah, that's it. So you have to guide practitioners to focus and exclusively work on the areas that are stiff without, see, if I loosen what's loose and I loosen what's tight, you actually increase the contrast between the tight and loose areas because the loose areas get looser faster than the stiff areas get looser. So that's why we need to absolutely leave alone as best we can the hypermobile areas to bring these stiff areas back online and then balance your spine so that this part of your back is working properly.
So as you loosen this up today,
Yes, sir.
are my ribs going to naturally feel better just because you loosen up my
No, you're going to be sore up here. These areas that are stiff don't embrace me with open arms. Tomorrow morning specifically, Ed, my lower back feels a little bit better. My middle back is now sore, right? I expect some level of apprehension in these areas that have old injuries to the narrative that I'm preaching, which is that we need to restore the function of this area. This area most likely is going to be tender, and I'll give you a thumbs up. I don't think anybody's ever told their orthodontist when they started putting braces on that it felt wonderful. Your bones have had a habit of being in a certain position, and we're going to start changing that for the longevity of your spine. They don't necessarily usually like that.
Yeah.
It's why I make friends on visit 5, 6, 7. The
Wow.
first few visits are like boot camp. If you haven't gone to the gym in a few years and you go to the gym and do a big workout, the next day you're not going to feel great.
Right.
You're out of shape. You are out of spinal shape. Part of your back
Crazy.
is underperforming, and we don't feel the areas that don't move. So the areas that are frozen, I didn't realize how stiff that was, Ed, until you touched it. Like right here, it's way too stiff.
Yeah, the crunching there is intense.
That's the problem. The fact that you have any thoracic pain means that it still functions a little bit. It's just dysfunctioning. So it's a good sign in the sense that you have some feeling in this area. If people come in and their thoracic cages are totally frozen, they have zero symptoms in that area. They would just only feel the lower back. And that explains probably why the facets are not upset, because you have some joint function up here. Limited, but it's not completely frozen.
I mean, I'm craving someone sticking like the butt end of a butter knife between my ribs. Like that's
I understand.
what I feel like I wish someone would do, but
Point
stuck
where it hurts.
You're stuck with my elbow.
that's what I said to my chiropractor back in Omaha. I was like, can you just go between my rib cage and just
Unglue me.
hurt me?
Yep, it's all up here. You got it. You pretty much instinctively.
So this would be why swimming makes my arm go numb. My cervical.
You're bending too much in your lower neck, yes, sir. It's all it means.
Yeah, by about lap 5, I have a numb arm.
Yeah, it's 100%. I'm so sorry people aren't. Wow, that's not good. Not good that we're not diagnosing this properly.
I have had some lower lumbar tightness. The last, just like on and off the last couple months, it's just random. There's no particular rhyme or reason. Maybe I'm standing in dress shoes. That might be it.
Actually, the tightness is guarding. Your body, something's getting upset, the nerve is getting pinched, and then muscles get tight as a result. The muscles aren't the problem. They're the result of a problem.
Got it.
They're the response to a nerve being aggravated. It's a mechanical problem. You have part of your spine up here not working, and the alignment of your lumbar being incorrect. When the lumbar curve goes straight, like a ladder, all the weight is transferred to L5 and L4. Hence why those two discs encounter about 99% of surgery. You're only chewing on 2 teeth in your mouth. And so only the teeth that you kept chewing on are the ones that you ground down. But you have all these other teeth in your mouth that you're not chewing on. We need to teach you how to chew on those other teeth. You need to learn how to bend up here and restore the function of the rest of your spine, which is young.
So these 3 fingers are numb.
Put it underneath your chest. Put it underneath your chest. Put it underneath your thigh. If that happens, if that happens in the right hand.
Okay.
When you lay face down on this table, the headpiece does not let you put your head forward. Do you understand? Mm-hmm. This headpiece is holding your head over your shoulders. If I allowed your head to go forward, your hands wouldn't go tingly. You understand? If I let you assume the old person posture.
Right.
Do you understand?
Right.
Part of your treatment today is surviving laying face down on my table. Do you understand? Yeah. Because it's holding you. You're actually stretching the spine into a neutral position. And if neutral isn't fun, I've had people that can't even lay face down on the table. I had a firefighter the other day. Even laying face down on the table caused his hand to have shooting pain. Right? So I had to lift the chest piece up and let him have his head forward while I worked on him as a crutch. Right? And after a few visits, he was able to lay face down. In your situation, neutral is pinching it. And so, again, this is why we can't throw people on stretches. So now if we ask people for extension, it's too much. And this is why I have an office. Otherwise, I would just get on QVC and sell stretches. Why have an office at all? You can't just throw people on stretching devices.
Right. I walk out of those offices.
I know, I get it.
Actually, I usually don't make it in.
You don't even get in.
I look at their pictures.
How's the hand doing? Is it calming down?
Yes, sir.
Yeah.
It's normal now.
Yeah. Just put it on. That just shows me how close to the cliff edge you are. The nerve is that close. Just a little bit of what this does is it opens up this channel. Bringing your arm down opens up the channel by a few millimeters, and then the nerve gets. Again, this is another validation of it's a neck problem.
Okay.
All I did was change the position of this, and the hand is happy again.
Are you in the gym a lot?
I do. I go pretty hard 3 days a week. I run now that I can run. I've been running like 2 miles once a week because that's all I can do, and then I swim and lift too.
Yeah, it's just you're an athlete. You need a car mechanic. You know, it's
Yeah.
and those are expensive hobbies for your spine. But the problem's all up here. It's all ultimately the thoracolumbar junction here, loss of lumbar curve, rigidity of your thoracolumbar junction, hypermobility of L5.
This feels like every Asian massage I wish I could have gotten but didn't.
I understand.
And you go in and meet those little old ladies with their elbows. This is what I really want you to do.
Yep, that's it. You just need to get all this untangled in here. You're an athlete. Your lats are tight. Your
Yeah.
traps are tight. You got a lot of power, but with power comes stiffness. You know, because you have to lock your chest to bench press. You have to lock your chest to be a quick runner. And so with great power comes great responsibility.
Yeah.
Thank you, Uncle Ben.
Yeah.
With great power. All right there. Come on.
I'm just letting you know, because he said his Uber would be here at 4. It's
How much time?
3:45.
Okay.
Shoot.
Okay.
But, so I'm like,
Thanks for the.
I feel so bad. Do you think your Uber, or your flight, or?
It's more my flight than
Yeah,
the Uber.
yeah.
I'll
Yeah.
get you out of here. I'll get you fixed up. Let me just
So
get these
sorry.
ribs down. All right there. Yep. Come on.
I wish I had more time. I tried to change my flight. I
No,
couldn't.
it's-
You're always welcome to come back down here again, and I'll spend a couple days if you can. If you have the ability to, I'll fix you up quick.
Vacation.
Yeah, I have a little more flexibility now. But
Have you used a foam roller before?
I own one, yeah.
Uh-huh.
I have a thumper and I'm pretty equipped.
Okay.
I have a lot of stuff.
I'm going to show you what I want, and then you can decide what you want to do. But I'm going to show you the bar that you have to be able to jump over,
Okay.
and the minimum to get relief is to be able to master these bars. Okay.
Will my legs start to relax naturally?
As the lower back calms down, your legs will feel better. It's all about giving your lower back a vacation. The
Okay.
mark that is apparent now right here on your left side is evidence of the restriction. The mark comes up in areas of stagnation, of
Right.
stiffness, of tightness, of blockages. Yeah.
I prayed for you.
Hey, I'm glad you're here. Well, my bread and butter, bud. This is my bread and butter. All I do is I wake up this morning and I fix spines and I go to bed.
Oh, I think it's more than that.
Oh, well,
I think you give people their life back.
we'll get you back, bud. I'm not joking. I believe 80% of your spine is young. It just doesn't
Yeah.
work properly or well.
It's okay.
So you have plenty of potential to live a long life and have a happy time and not have drugs and surgery. You just have to unlock, and we have to keep these areas that are frozen or tighter than they're supposed to be. We need to keep them functioning optimally. And that's it. It's just... okay, let's get the glute. This, you
Oh,
got
yeah.
it.
Oh,
I know, bud, I know.
that actually hurts.
Somebody's got to go in here and unlock this joint better,
Okay.
so that when we put you on your side and twist you, this joint needs to be the one that is functioning.
I take it a lacrosse ball is not quite going to do the trick.
Well, yeah. Otherwise I'd sell lacrosse balls. Right, exactly. Nothing beats the elbow, but yes, you gotta go in here and unlock this joint. Right there.
Yeah, that feels like nerve pain.
Yep.
So my glutes are tight because they're protecting my lower back.
Sitting locks these glutes. It's sitting. Sitting does it.
Oh, I sit a lot.
That's the main culprit for why the SI joint is frozen. I got you. I'm not gonna hurt you. Breathe for me. Relax. Yeah, you're not ready. You're not ready. You gotta get more suppleness up there. Lift your head for me. Put your forehead on your forearm. Keep that forehead on your forearm for me. Breathe for me, bud. Exhale, relax your back.
Ow!
Where?
We're just below your hand.
Where I'm pressing? Okay.
Just below it.
Okay, it's okay. It needs to unlock. Yeah. Okay, all right. If it was down the arm, that's one thing, you understand? You felt something down the arm, we stop. But if it's just hurting here,
Yeah.
that's a, arms down. Yeah, I got you, buddy. I know, you gotta work through that. You gotta be able to, this area doesn't want to function. All right, you said when you were laying face down, I had you arching back. And that compresses the nerves a little bit because we gotta take the weight off the disc. But in the same time we're taking the weight off the disc, which is the real injury, we're putting weight on the areas that have feeling. So this is why most doctors don't do what I'm doing, because there's a temporary difficulty as you unlock somebody and bring them back to the right posture. So most physical therapists do the opposite. They lay you on your back and just pull your knees to your chest, right? Which makes you feel great while you're doing it, and you feel great when you're walking out the door, but then you're worse later in the day. Right in that lower back,
Okay.
lay on your side about 10 minutes. You hold it with a paper towel, hold an ice cube, numb that down. A back brace, if you're not doing any, you of course always lift with a back brace, right?
I mean, I don't really lift. Like, oh, you mean in
At the gym, yes sir.
Oh, no.
You should always have a back brace. That should be a given.
Okay.
I would, if you want, my father walked in, he'd tell you no more gym, but I'm saying if you're gonna do it, you better be dang sure you got a protective brace on there, on the lower back. Just like the big professional weightlifters, they crank those puppies down because they're trying to protect L5.
Yeah.
And if you're gonna be doing stuff, we better be putting an external brace on it. That's a Band-Aid, but it will help to lessen the stress and make this area more likely to bend because now you have this external brace limiting mobility where you're bending too much.